have to realize that they can't keep treating doctorate level professionals as replaceable parts in a machine. We're talking about what's going to happen when I become a grandfather, hopefully. By 2045, this is what's going to happen in pharmacy. What I'm sharing is something that's raw. It's from my heart. It's something that has been developing over the last 7 years of my career as a pharmacist, as an entrepreneur in the Happy PharmD, and I feel like it is my life's work. Something has to change in our profession. It's not just technology, the healthcare system, insurance, workflows, work demands. I'm talking about a fundamental way that we think about pharmacy and our work, our career. I've been thinking a lot. And it's time that we have to talk about our relationship. Just kidding. I've been thinking a lot about where we're headed. And honestly, it keeps me up at night. Seeing so many talented pharmacists stuck in roles that drain them, that make them feel like bad parents, bad partners, that make them feel like they're bad pharmacists. They drain them. It causes burnout. It causes anxiety, divorce, and it doesn't align with who they are. I'm more than frustrated that I have to hear about another pharmacist who's stuck. Since 2017, I've had the incredible privilege of running this company, the Happy PharmD. We've been in the trenches now with pharmacists, coaching them, educating them, supporting them, and watching them transform their careers. And I've noticed a trend. What gets me really excited is seeing these pharmacists go from like the familiar burned out path and feeling frustrated about the job market to discovering what they can do, to getting more aligned with their potential, with who they are, what they're all about, what they're passionate about. So between now and 2045, pharmacy is going to look completely different. We're going to see massive innovations. We're going to see changes in the drug supply chains. We're probably going to get that provider status that we've been talking about forever. But let's be real. I think technicians are going to step up and take on many traditional pharmacy roles. I think a lot of people are going to be laid off. I think that big chains, big hospitals know that pharmacists at a really basic level are really expensive, and many of the tasks that they can do can be done by less educated and less expensive people. And so I think there's going to be a great displacement over this time period that many people are not prepared for. I also think that clinical pharmacy is going to grow, and I think more complex demands are going to be made on pharmacists. I think that the future is complex and it's going to get harder, and I believe that pharmacists can be at the forefront of that change, making a difference for patients, providers, and health systems. And I believe that my company is going to help 35,000 pharmacists find and get fulfilling roles so that they too can be happy with what they do on a day-to-day basis. Now that number, that's roughly 10% of our entire profession. You may be thinking, Alex, that's a lot. Or maybe that's not a lot. That's not the whole profession. Why not the whole profession? Well, here's the thing. I've seen this over and over again, from history to stories, that it only takes a small group of committed people to spark a revolution. Whether you think of people like Gandhi, leading an independence movement for an entire country, Martin Luther King Jr. for fighting for civil rights, or spiritual leaders like Jesus or Muhammad, who frankly have transformed entire societies. I want to be clear, I'm not comparing at all what we do with the monumental achievements of these people. But these leaders I use as inspiration to push us in to do something hard, something challenging, and something incredibly powerful and fulfilling. It doesn't take everyone to create change. It takes a small group of committed people to spark something. People who are willing to stand up and say, enough is enough. If 10% of pharmacists leave toxic workplaces for better work opportunities, these companies will have to take notice. They have to realize that they can't keep treating doctorate level professionals as replaceable parts in a machine. Healthcare has to change. It's broken, and we've all seen it. And by 2045, I believe we will see companies treating pharmacists with respect they deserve by our catalytic coaching. They'll realize that they can't keep treating pharmacists this way because they're going to work with us. They're going to work with us to find out what their true potential is to get a better job that will treat them like the potential that they truly have. But it won't happen on its own. That's why I'm sharing this vision with you today. If this vision resonates with you, if you're feeling like that spark of, yes, this needs to happen, we need help. Whether you're looking for coaching to transform your career or you just want to support our mission, every voice matters. Here's the truth. The only way we're going to do this is if our voice gets louder and the collective voice comes together and says, enough is enough. It's time we enjoy our work. It's time, because we've worked way too damn hard to do what we do. To get paid what we get paid, to risk what is at risk, to not at least enjoy what we do. This isn't just about career changes. It's about healing our profession. And it can only happen one pharmacist at a time. That's the vision I have for 2045. That 10% of pharmacists absolutely love what they do because of our work. And it will change how companies treat their future professionals. Because if that can happen, then everyone will win. Patients, healthcare systems, and from my perspective, most importantly, you, the pharmacist. So until I see you in the next video, stay curious and take care.